As individuals age, the natural physiological changes that occur in the body can profoundly influence intimate health, shaping physical function, emotional resilience, and relational dynamics. While aging is an inevitable biological process, emerging medical research underscores that proactive, evidence-based strategies can mitigate challenges and foster intimate wellness well into later life. This passage explores 7 interconnected approaches to enhancing intimate health as part of a holistic aging journey, weaving together insights from endocrinology, nutrition, psychology, and preventive medicine to illuminate the multifaceted nature of this vital aspect of human health. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment with a 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial, as it helps me create better videos that align with your interests. Now, let's embark on this journey together. The foundation of intimate health lies in understanding the biological shifts that accompany aging. For individuals assigned female at birth, the transition through perimenopause and menopause heralds a decline in estrogen production, a hormone integral to maintaining vaginal elasticity, lubrication, and pH balance. This hormonal shift often leads to vaginal atrophy, a condition characterized by thinning epithelial tissues, diminished blood flow, and increased susceptibility to discomfort, dyspareunia, painful intercourse, and recurrent infections such as bacterial vaginosis or urinary tract infections, UTIs. The psychological ramifications of these changes are significant. Many individuals report feelings of diminished self-esteem, anxiety about sexual performance, or grief over perceived loss of femininity. Similarly, individuals assigned male at birth experience gradual reductions in testosterone levels, a process sometimes termed andropause, which can manifest as erectile dysfunction, ED, reduced libido, or delayed ejaculation. Testosterone also plays a role in maintaining muscle mass, bone density, and mood stability, meaning its decline can indirectly affect intimate health through fatigue or depression. However, these outcomes are not inevitable. Advances in medical research have identified interventions that can restore function and improve quality of life. For example, localized estrogen therapy, administered via vaginal creams, tablets, or rings, has been shown in multiple randomized controlled trials to alleviate symptoms of vaginal atrophy in 60 to 80% of users by replenishing tissue integrity and moisture. Systemic hormone replacement therapy, HRT, while effective for broader menopausal symptoms, carries risks such as thromboembolism or breast cancer, necessitating personalized risk-benefit analysis under medical supervision. For men, testosterone replacement therapy, TRT, can improve libido and erectile function in cases of clinically diagnosed hypogonadism, though its use remains controversial due to potential cardiovascular risks and the necessity for lifelong commitment. Emerging therapies, such as selective estrogen receptor modulators, SERMs, and androgen receptor agonists, offer promising alternatives for those ineligible for traditional hormone treatments. Beyond pharmacology, lifestyle modifications like stress reduction and weight management can naturally modulate hormone levels. For instance, obesity exacerbates hormonal imbalances by converting testosterone into estrogen in adipose tissue, creating a feedback loop that further suppresses intimate health. Thus, addressing the root causes of hormonal disruption, whether through medical, nutritional, or behavioral interventions, forms the cornerstone of sustaining intimate vitality. Nutrition plays a pivotal and often underestimated role in intimate health, acting as both a preventive and therapeutic tool. The adage, "you are what you eat," holds particular relevance here, as dietary patterns directly influence hormonal synthesis, vascular function, and microbial balance, all critical to sexual wellness. Omega-3 fatty acids, abundant in fatty fish like salmon and mackerel, as well as plant sources like chia seeds and walnuts, are potent anti-inflammatory agents that enhance endothelial function, promoting healthy blood flow to genital tissues. This vascular support is particularly crucial for erectile health, as erectile function relies on the ability of blood vessels to dilate efficiently. Zinc, a mineral found in oysters, beef, and lentils, is indispensable for testosterone production and immune regulation, with deficiencies linked to hypogonadism and impaired wound healing in genital tissues. Antioxidants such as vitamins C and E, present in citrus fruits, berries, and almonds, combat oxidative stress, a key contributor to erectile dysfunction and vaginal mucosal degradation. Phytoestrogens, plant-derived compounds found in soy products, flax seeds, and tempeh, mimic weak estrogenic activity and may alleviate mild menopausal symptoms, though their efficacy varies widely among individuals. A landmark 2022 meta-analysis published in the Journal of Sexual Medicine revealed that adherence to a Mediterranean diet, characterized by high intake of fruits, vegetables, whole grains, olive oil, and lean proteins, correlated with a 40% reduction in ED risk among men over 50, likely attributable to improved cardiovascular health and nitric oxide bioavailability. For women, diets rich in fermented foods like yogurt, kefir, and kimchi support a robust vaginal microbiome by fostering lactobacilli dominance, which acidifies the vaginal environment and inhibits pathogen growth. A 2021 study in urology demonstrated that daily consumption of probiotic-rich foods reduced UTI recurrence by up to 50% in postmenopausal women, highlighting the symbiotic relationship between gut, urinary, and reproductive health. Hydration, often overlooked, is equally critical. Chronic dehydration exacerbates vaginal dryness and urinary irritation, while adequate water intake ensures optimal mucosal hydration and toxin clearance. Beyond macronutrients, micronutrient deficiencies, such as low vitamin D levels linked to pelvic floor dysfunction, underscore the importance of comprehensive dietary assessments. Collaborating with a registered dietitian to address individual needs, allergies, or cultural preferences can transform nutrition from a passive factor into an active strategy for intimate wellness. Physical activity, particularly exercises targeting the pelvic floor, serves as a cornerstone of intimate health across the lifespan. The pelvic floor muscles, a network of tissues stretching like a hammock from the pubic bone to the tailbone, provide structural support to the bladder, uterus, prostate, and rectum. With age, these muscles often weaken due to childbirth, hormonal changes, chronic constipation, or sedentary lifestyles, leading to urinary incontinence, pelvic organ prolapse, or diminished sexual sensation. Kegel exercises, which involve repetitive contraction and relaxation of the pelvic floor, have long been advocated for strengthening these muscles. A 2020 randomized controlled trial in menopause found that women who performed supervised Kegels 3 times weekly for 12 weeks experienced a 30% improvement in sexual satisfaction, alongside reduced episodes of stress incontinence. For men, pelvic floor physiotherapy has gained traction as a first-line treatment for ED, particularly in cases where psychological factors or vascular insufficiency are implicated. A 2019 systematic review in the Journal of Sexual Medicine reported that men undergoing pelvic floor rehabilitation achieved a 40 to 60% improvement in erectile rigidity, comparable to the efficacy of oral phosphodiesterase 5 inhibitors, PDE5 like sildenafil. Beyond targeted exercises, aerobic activities such as brisk walking, cycling, or swimming enhance cardiovascular fitness and nitric oxide production, a molecule essential for vasodilation and genital blood flow. Resistance training, particularly compound movements like squats and deadlifts, preserves lean muscle mass and stimulates testosterone secretion, countering age-related sarcopenia. Even low-impact practices like yoga and Pilates improve flexibility, core stability, and body awareness, which can translate to greater comfort and confidence during intimacy. For example, yoga poses such as Malasana, Garland pose, and Satubandhasana, bridge pose, gently stretch and strengthen the pelvic region, while mindful breathing techniques reduce performance anxiety. Importantly, physical activity also mitigates systemic inflammation and insulin resistance, two metabolic disturbances implicated in both ED and vaginal atrophy. Thus, integrating movement into daily life addresses intimate health through both mechanical and biochemical pathways, reinforcing the adage that motion is lotion for the body. Mental and emotional well-being, though less tangible than physiological factors, are inextricably linked to intimate health. Chronic stress, anxiety, and depression activate the hypothalamic pituitary adrenal (HPA) axis, triggering a cascade of hormonal changes that suppress gonadotropin-releasing hormone (GnRH) and, consequently, sex hormone production. This neuroendocrine disruption manifests as reduced libido, anorgasmia, or aversion to intimacy. Cognitive behavioral therapy, CBT, a gold standard psychological intervention, has demonstrated remarkable efficacy in breaking cycles of negative thought patterns surrounding body image, performance anxiety, or past trauma. A 2023 multi-center study published in the Journal of Sexual Medicine found that participants who completed an 8-week CBT program reported a 50% reduction in sexual anxiety and a 35% increase in desire, with effects sustained at 6-month follow-up. Mindfulness-based stress reduction, MBSR, incorporating meditation and body scan exercises, lowers cortisol levels and enhances present-moment awareness during intimacy, fostering deeper emotional and physical connections. Sleep, often termed the third pillar of health alongside diet and exercise, is another critical yet underappreciated factor. Poor sleep quality disrupts the pulsatile secretion of testosterone and growth hormone, while chronic insomnia correlates with higher rates of sexual dysfunction. Prioritizing sleep hygiene, consistent bedtimes, limiting screen exposure before bed, and creating a restful environment can thus have cascading benefits for intimate wellness. For couples, maintaining emotional intimacy through non-sexual touch, shared hobbies, and open communication is equally vital. A longitudinal study in Archives of Sexual Behavior, 2021, tracking couples over a decade found that those who engaged in weekly emotional check-ins reported 35% higher sexual satisfaction, underscoring the symbiosis between relational trust and physical intimacy. Importantly, societal narratives that equate aging with desexualization can internalize as self-limiting beliefs, making psychoeducation and community support pivotal in reframing intimacy as a lifelong journey rather than a youthful privilege. Regular medical screenings and proactive healthcare engagement form the bedrock of preventive intimate health. Many conditions affecting sexual wellness are insidious in onset, emphasizing the importance of early detection and intervention. For example, postmenopausal bleeding, a common symptom of vaginal atrophy, can also signal endometrial hyperplasia or cancer, necessitating prompt evaluation with transvaginal ultrasound or biopsy. Similarly, persistent erectile dysfunction may serve as a sentinel marker for cardiovascular disease, as the endothelial dysfunction underlying ED often precedes coronary artery disease by 3 to 5 years. Annual pelvic exams, pap smears, and STI screenings remain imperative for all sexually active individuals, regardless of age. CDC data reveals a 50% surge in STIs among adults aged 55 plus between 2015 and 2020, driven by factors like diminished condom use, postmenopausal vaginal thinning, and societal stigma discouraging older adults from discussing sexual health. For individuals with chronic conditions like diabetes, rigorous glycemic control is paramount. Hyperglycemia induces oxidative stress and advanced glycation end products, AGEs, that damage penile and clitoral vasculature, exacerbating neuropathy and ED medications. 2. Warrant scrutiny. Selective serotonin reuptake inhibitors, SSRIs, commonly prescribed for depression, can suppress libido and delay orgasm, while antihypertensives like beta blockers may impair erectile function by reducing cardiac output. Collaborative care models, where patients work with providers to adjust dosages or explore alternatives, e.g., switching to vortioxetine for depression or angiotensin receptor blockers for hypertension, can mitigate these iatrogenic effects. Dermatological conditions like lichen sclerosus, which causes painful vulvar or penile scarring, and psoriasis requires specialized care to prevent sexual discomfort. Furthermore, vaccinations, such as the HPV vaccine, now approved for adults up to age 45, reduce the risk of genital cancers, while bone density scans can identify osteoporosis-linked pelvic fractures that compromise sexual positioning. In essence, treating the body as an interconnected system enables preventive care to act as a linchpin for sustained intimate vitality. If you are still watching this video and find these lessons useful, please comment with a 2 below to let me know that you are still with me. Lifestyle modifications, particularly smoking cessation and alcohol moderation, exert profound effects on intimate health. Nicotine, a potent vasoconstrictor, reduces genital blood flow by up to 30% in chronic smokers, accelerating tissue hypoxia and fibrosis. A 2019 study in andrology found that male smokers were 50% more likely to develop severe ED than non-smokers, with cessation restoring vascular function within 6 to 12 months. For women, smoking hastens ovarian reserve depletion and menopause onset by 1 to 4 years, compounding vaginal dryness and dyspareunia. Alcohol, while initially disinhibiting, depresses the central nervous system, impairing arousal and orgasmic capacity. Chronic heavy use disrupts liver function, impairing estrogen metabolism in women and testosterone production in men. The NIH recommends limiting alcohol to 1 drink daily for women and 2 for men to avoid compounding age-related declines in hepatic and hormonal health. Substance use disorders, including opioid dependency, further disrupt intimate health by blunting libido, inducing anorgasmia, and straining relational bonds. Interventions like cognitive behavioral therapy for substance use, CBIS, and 12-step programs offer pathways to recovery, realigning lifestyle choices with long-term wellness goals. Environmental toxins, such as endocrine-disrupting chemicals, EDCs, in plastics and pesticides, also warrant attention. Phthalates and bisphenol A, BPA, have been linked to reduced sperm quality, ovarian dysfunction, and early menopause. Opting for glass food containers, organic produce, and phthalate-free personal care products can minimize exposure, safeguarding hormonal equilibrium. Finally, embracing medical advancements and non-hormonal therapies expands the arsenal for maintaining intimate health. For vaginal dryness and atrophy, over-the-counter moisturizers containing hyaluronic acid or vitamin E provide immediate relief, while pH-balanced lubricants reduce friction during intercourse. Fractional CO2 laser therapy, a minimally invasive procedure, stimulates collagen production and neovascularization in vaginal tissues, improving elasticity and moisture retention in 70% of patients, per a 2021 JAMA Dermatology study. For ED, oral PDE5 inhibitors like sildenafil remain first-line treatments, but newer modalities like low-intensity shockwave therapy, LIST, show promise in regenerating penile microvasculature, with 65% of men achieving sustained improvements in erectile function after 12 sessions. Platelet-rich plasma, PRP, injections, though experimental, are being explored for both male and female sexual dysfunction, harnessing growth factors to rejuvenate tissues. Psychological interventions, including sensate focus exercises and sex therapy, help individuals and couples adapt to physiological changes by emphasizing pleasure over performance. Telehealth platforms now offer discreet access to sexual health specialists, breaking down barriers of stigma or mobility. Importantly, cultural competence in care, acknowledging diverse gender identities, sexual orientations, and relational structures, ensures that interventions are inclusive and patient-centered. In conclusion, enhancing intimate health with age demands a holistic, proactive approach that harmonizes medical innovation, nutritional wisdom, physical vitality, and emotional resilience. By fostering open dialogue with healthcare providers and partners, prioritizing preventive care, and embracing adaptive strategies, individuals can navigate aging with confidence and grace. Intimate health is not merely the absence of dysfunction but a dynamic reflection of overall well-being, a testament to the enduring human capacity for connection, pleasure, and joy across the lifespan. Aging is not a surrender to decline, but an invitation to adapt, grow, and thrive. The strategies outlined here are not mere recommendations. They are tools to reclaim agency over your intimate health, a vital component of your overall well-being. Whether you're navigating hormonal shifts, redefining intimacy after decades of partnership, or exploring new ways to connect with your body, remember that small, consistent steps can yield profound transformations. Start today by initiating an open conversation with yourself, your partner, or a trusted healthcare provider. Ask questions, voice concerns, and seek personalized guidance. If vaginal dryness or erectile dysfunction feels isolating, know that effective treatments exist. If stress or stigma weighs heavily, recognize that mental health support is not a luxury but a necessity. Schedule that overdue pelvic exam, experiment with a Mediterranean-inspired meal, or dedicate 10 minutes daily to mindfulness or pelvic floor exercises. Embrace the power of prevention and refuse to accept discomfort as inevitable. Your intimate health is a reflection of your holistic vitality, a lifelong journey deserving of attention, respect, and care. By prioritizing it, you honor not only your body but your capacity for joy, connection, and resilience at every age. The time to act is now. Your future self will thank you. If you enjoyed this video, please like, share, and subscribe to our channel. Thank you for watching, and we can't wait to see you in our next video.